To most Canadians, tuberculosis seems like a disease from the past, but in the north, it's a very present danger. More than 100 active cases were diagnosed last year in Nunavut. The Inuit have lived with high rates of TB ever since they first settled in permanent communities in the 1940s. Poverty, poor housing, and above all, overcrowding have kept the bacterial infection going among young and old alike.
So what did Tiger
Kevin Kablutsiak was 16 when he was diagnosed with TB in Arviat, Nunavut, and went through 9 months treatment. He says some people were afraid to be around him.
We have to encourage each other to talk about it, to understand how TB works, how it's contracted, and that it is curable. And that, if you have TB, you get treated and it's okay.
This is now the first time that the Government of Canada is saying that TB control is not enough. Just managing the elevated rate of tuberculosis in Inuit Nunavut is not enough.
The hamlet of Kikik-Tarjuak is the worst affected in Nunavut. 1 in 10 residents has TB. Starting last month, a mobile clinic tested 90% of the town's population. The good news is that there are new diagnostic tests and also new treatments available, and both work much faster than what's existed before. So that means a new opportunity to get ahead of this contagious disease and stop its spread.
It's not rocket science. We're in a position where we have the best technical and diagnostics tools that have ever been in existence.
But Dr. Gonzalo Alvarez says medicine alone won't be enough to defeat a disease that thrives in crowded living conditions.
This disease is more complex in that it is so linked to the social determinants of health. And so we need to see investments in, for example, housing, which I think is absolutely critical.
The federal government says it'll spend $640 million over 10 years to improve Inuit housing and hopes to be able to declare all Inuit regions TB-free by the year 2030. Evan Dyer, CBC News, Ottawa.
As Evan mentioned, this is not a new problem, not at all. By the 1950s, an estimated 1/3 of the Canadian Inuit population was infected with TB. And if the disease hurt communities in one way, in another, so did the government response.
He realizes that as a result of our survey, he may be taken away from his home.
Instead of treating patients locally, which was the practice in Alaska, for example, in Canada, patients were taken away from their homes and sent south for months, even years. At the time, it was portrayed as a humanitarian act.
And for the Eskimos, an apprehension. For the doctors and nurses aboard the Howe are concerned with their health, and their examinations may mean an exile in one of the crowded cities of their fellow Canadians to the south.
The ship, the CD Howe, toured the north, diagnosing and spiriting people away for treatment.
No shame in this number. It's a safeguard against confusion in the records.
Throughout the 1950s, records show more than 5,000 Inuit were sent south. For perspective, Canada's Arctic then had a population of about 30,000.
After 18 months, it's still not cured. But the loneliness is over.
Children, in particular, could return estranged from their community. Many never returned. Families never told where they were buried. Foreign-born Canadians are also disproportionately affected by TB. They represent 20% of the population, but 70% of the cases of TB.
Where we'll be in Ottawa with the Prime Minister to have a statement in acknowledging the wrong that was done to us many years ago.
On Monday, Justin Trudeau is expected to make a formal apology to the Chilcotin First Nation. More than 150 years ago, 6 chiefs from that nation were accused of murder, convicted, and hanged. They were trying to preserve their traditional territory during a war with European settlers. In a 2014 landmark decision, the Supreme Court found the Chilcotin had Aboriginal title to segments of their traditional land.